is now starting. All attendees are in listen-only mode.
Hello everyone and welcome to today's online class. My name is Christina Roque and I am the Health Education's webinar coordinator. Today's webinar is Navigating Highs and Lows for Diabetes Management. Today's health educator is Vanessa Alardo. Vanessa is a registered dietitian who graduated from Loma Linda University with her master's in public health. She currently works as a corporate health and wellness educator and registered dietitian for Beaver Medical Group. She has presented to many groups on a wide variety of health topics and will be presenting today's webinar. Welcome, Vanessa.
Thank you, Christina, and welcome everybody to today's class. So if you've ever experienced the highs and lows of hyperglycemia or hypoglycemia, you know that they can be very difficult to deal with. So for some individuals, they might get really bad headaches. For others, they might get sweaty or hungry because they've had lows for too long. Maybe you get confused because you're having foggy brain for having too high or too low a blood sugar. So if you do get any of these symptoms, you know that after they're all said and done, you can be left feeling very fatigued. So today we're going to talk about different prevention techniques and what you can do to better manage your highs and lows. But before we talk about managing your highs and lows, let's talk a little bit about what the pancreas does in the body. So as you can tell from this picture, you have three different types of pancreases. The first one, there's a healthy pancreas. And with the healthy pancreas, with someone who doesn't have any type of diabetes, the pancreas is producing insulin, and it's producing it effectively so that when it attaches to the cell, as you can see on the far right, it allows glucose to then enter the cell to be utilized by the body so that you can have energy to do all the different things that you do on a day-to-day basis. With type 1 diabetics, the pancreas isn't actually producing any insulin at all. So if you know a type 1 or you are a type 1 diabetic, you might be given insulin shots or an insulin pump to be able to then get insulin to the cell so that it can open up the cell so glucose can go inside and be utilized. With type 2 diabetics, insulin is being produced, but because of so many types of lifestyle-related factors, it's the cell's receptor has become damaged. So even though the insulin is being produced, the insulin receptors are no longer activated so that the glucose can go in and be then utilized by the cell to create energy for the body. So that's the difference between all the different types of pancreases and what insulin does in the body. So if you're newly diagnosed and you've never heard about what insulin does, your pancreas, this is a great picture to use to be able to give you a mental image of what's happening in your body and how you get highs and lows. Basically because maybe you eat too much, then you have too much, or you have high blood sugars, or you don't eat enough, and then you have low blood sugars. So if you are testing your blood sugars to see what they are before or after dinner you want them to ideally be between 70 and 130. So if you see that they're below 70, that would be called hypoglycemia or low blood sugar. If they're above 130, then that would be called hyperglycemia. So if after a meal, if you test it, let's say 2 hours after you eat something, and it's above 180, it should be less than 180, so if it's above 180, then you also have hyperglycemia, and you might experience some of the symptoms that we talked about earlier, which is fogginess, shakiness, maybe you're super thirsty, going to the bathroom a lot, different things like that. For some individuals, they've told me they don't experience any of those symptoms, even if they have highs or lows. So that may just be that your body has gotten so used to those highs and lows that it no longer is telling you when you're having those. Or you might not be very in tune with your body and knowing what those symptoms are actually doing or what they're for. So it is important that if your doctor recommends that you test your blood sugars, that you do that often so that you can see where you're at any given day, and then you can treat those symptoms or also prevent them. So if you're having hyperglycemia, which is, again, as I mentioned earlier, above 130 before eating or above 180 after eating, then you might experience some of the symptoms that you can see at the far right: hunger, frequent urination, dry skin. So I've already mentioned some of those. But the reasons that you get hyperglycemia is maybe you ate too much or ate more than you planned to. So let's say around the holidays you saw all those great pumpkin pies or all those desserts. I know I definitely ate a few more cookies than I should have. But if you ate more than you planned, then you might experience those highs. If you're also sick at the same time or even separately, you have a cold or flu, that stress that's being put on the body can also increase your blood sugars. And another reason is if you have too much stress in your life. So if you have things going on in your family, maybe you have conflicts, someone passed away recently, or you have a lot of things to do at work, your kids are driving you crazy, whatever it may be, those stressors can actually increase your blood sugars as well. So it's not just the food that you consume that increases your blood sugar, but it also can be illness and stress that you have in your life. So it is important to manage all those lifestyle things and habits. So one quick way to be able to lower your high blood glucose, if you do see that it's high when you check it, is to go for a 10-minute walk. That's the quickest way to reduce that high blood sugar so that you can use up that energy and that excess sugar that you have in the bloodstream. Another way for a more long-term way to be able to increase insulin sensitivity is to lose a little bit of weight. So exercise, again, will help with that. So being physically active is super important. Whatever you can do to get back on the treadmill or even go for more walks is really great. So if you're not used to exercising right now, at least start with a 5-minute walk daily, and then you can build it up to 10 minutes and then 15 minutes and keep going as you build it up and you feel better about it. You can just keep adding time. You can also dance around the house. It doesn't have to be walking. You can even move your arms up and down for physical activity. So it doesn't have to be necessarily getting on a treadmill. It can be any form of movement. So about a 5 to 7% weight loss is highly beneficial in being able to produce that insulin sensitivity that you're looking for to bring your numbers down. So that's about a 5 to 10 pound weight loss. Diabetic snacking is also really great for hyperglycemia. So when you eat a carbohydrate by itself, let's say like an apple, or you're eating spaghetti, rice, bread, any of those carbohydrates alone may increase your sugars way faster than if you eat it with a protein or a fat. So here are some healthy snacks that you can choose from that incorporate a protein and a fat with a carbohydrate. So one you can do is apples with peanut butter. Another one you can do is almonds with some raisins. That's a protein with a carbohydrate. You can do 6 crackers with an ounce of cheese, a slice of whole wheat bread with 2 tablespoons of peanut butter. All of those are considered 1 carb with 1 protein and will help to balance out your blood sugar so it doesn't spike. Another thing you want to take a look at is the glycemic index of food. So this is just to kind of give you an idea of which foods have a higher glycemic index than others so that you don't have to go around and check all the glycemic index numbers, but you can get an idea of which ones are a little bit higher by just looking at this slide right here. So those that are going to be higher are things like white bread, instant rice, cornflakes, corn chips, baked potatoes, pumpkin, all of those things that spike your blood sugars up much faster than if you were to eat a whole grain such as rye grain, dried beans, tomatoes, cherries, and yogurt. All of those have a lower glycemic index. So right after eating those, your blood sugar isn't going to rise as quickly as if you were going to eat something that had a higher glycemic index number, such as white bread or instant rice. So try and choose things that are more whole grain, vegetables, as well as more complex fruits, whole grains, things like that, are going to be a lot better than your refined carbohydrates, which spike your blood sugars. All right, so let's talk about hypoglycemia, so low blood sugars. So if you do test your blood sugars regularly and you find that it's less than 70 milligrams, that would be considered low blood sugar. You might experience things like shakiness. I know that even when I get, my blood sugars are a little bit low because I haven't eaten enough. I do get shaky or sweaty, anxious, and then I think to myself, what's going on? And I realize that the last time I ate might have been 4 or 5 hours ago, which is not a good practice to do, and I don't do often. But if it does happen because you're traveling or you're really busy that day, it's normal and it's going to happen from time to time. But you might experience those symptoms and you might be thinking to yourself, maybe I have hypoglycemia, which could be very well true. So things that cause that is waiting too long to eat, as I mentioned. If you are taking insulin or you are exercising but you're not eating enough, then again that will cause hypoglycemia. With type 1 individuals, fluctuations in blood glucose is very common, so it's really difficult to tell if you're having a high or low because it's always fluctuating with type 1s. And then with liver disease, that's another reason why you might get hypoglycemia. So treatment for hypoglycemia would be to, first of all, take a deep breath when it does hit you, because it can be very scary, especially if someone's not used to it, or you might feel very out of it or groggy. So instead of immediately rushing to the fridge and grabbing the first thing you see, which most people tell me is a soda, or they eat a whole sandwich and then a soda because they get so desperate to get glucose in their body. Instead, take your time and only consume 15 to 20 grams of simple carbs. So again, you don't have to sit there counting your grams, but here are some examples of foods that have 15 to 20 grams. So a glucose tablet would be good. 2 tablespoons of raisins also has that amount of grams of carbohydrates. 4 ounces of juice would be great, or a small regular soda, not diet. So it doesn't have to be a huge can. You can just drink a couple of sips and you'll get that sugar that you need. 1 tablespoon of sugar or honey or corn syrup would also be useful. So then after you've consumed any one of those, you would recheck your blood sugars after 15 minutes and check to see where you're at. If it does come above 70, you're fine. So if it doesn't and it's still below 70, then try it one more time with another 15 to 20 grams of simple carbs, and then wait 15 minutes longer and check your blood sugars again. So keep doing that until you get your blood sugars above 70. But as I mentioned earlier, don't immediately just run to the fridge and grab whatever you see and just start munching on everything, because then your blood sugars could spike and go above 130. Okay? Timing of meals for increasing your blood sugar is also important. So if you are hypoglycemic more often than not, you'd want to time your meals out a little bit better. So if you're waiting longer than 5 or 6 hours in between meals to eat, it's really important that you try and create a schedule for yourself, as is shown here on this slide. You can take a pen and paper and just write out what works for you in your schedule. I don't know if you work night shifts or daytime shifts, but just write that out so that you have a cheat sheet, and then maybe set alarms for yourself, especially if you're somebody who tends to ignore your hunger signals, or you're really busy and you feel like you're not hungry, or you drink too much coffee, which actually takes away hunger, things like that. Then you might want to create a cheat sheet for yourself, because your body it's not really in tune, you're not in tune with your body as you should be. So you should be eating about every 3 to 4 hours, and that's how this cheat sheet that I created is utilized. It's a pretty common one for most people that work 8 to 5. So if you are monitoring your blood glucose, it is important that you keep a food journal and write down your numbers as well as the type of foods that you're eating to see which foods are affecting your numbers more than others. So for some individuals, wine might increase their blood sugar more than other people. White rice might increase your blood sugar more than other individuals. So that's why it's good to keep a food journal, just to keep track of which foods are affecting you more and in what quantity. A continuous glucose monitor is also useful for individuals who have type 1 diabetes, or even if you have type 2 and you can afford it or your insurance covers it. It's really great because it tracks your glucose without you even having to check it. It's just doing it on a continuous basis, so that you get a little printout and you can see what days or what hours of the day your blood sugars are going down, when they're going up, possibly what you ate that could have affected that. Maybe you're also writing down when you're stressed out. And so that continuous glucose monitor will tell you whether your stress is affecting you, all of those different things, and it'll alert you when your blood sugars are low or high, so that you can take care of that accordingly based on the things and tips that I taught you earlier. So in conclusion, it is important that you do offer the recommendations of your doctor and begin tracking your numbers if they do require you to do that, and do it as often as they're asking you. Try not to share your supplies with all your family members, but keep them for your purposes only. Also, keep that food journal. It's going to be really useful in helping you to see when you're getting your highs, when you're getting your lows, and what to do about those. And then time your meals so that you can avoid those highs and those lows as well. All right, if you enjoyed today's class, definitely join us for our future webinars. We have Change Your Plate for the Better, which I'll be teaching January 17th next week. We have Setting Your Goals That Last, which Marlisa will be teaching January 18th. And then we have a few other ones on the second slide that you can take a look at. You can also check out the flyers for these classes that I have in the handout section of the pane. So thank you so much for participating, and I hope you guys have a wonderful day in navigating your highs and lows.
Thank you, Vanessa, for that wonderful presentation, and thank you everyone for joining us today. If you have any questions for Vanessa, you can email them directly to this email here shown on the slide. A copy of today's presentation is available in the handout section of the task pane, along with the flyers for the upcoming classes. Once you close out of the webinar for today, you will be prompted to take a short survey. If you can do that and just let us know what you thought of today's webinar. And again, thank you for joining us and have a happy and healthy day.